We live stream this show, The Situation Room, which is Kenya's biggest conversation, on Facebook, on Twitter, on YouTube. Spice FM KE is our channel and our page, and you can find us all over there. So for the next hour as well, we will be live on KTN Home. Let's shift gears and come back to what's happening with the management of COVID-19 in the country. Now, of course, the issue now is not about beds. We have moved from beds to testing capacity to all those things to face mask. We moved from that into how much?
But does it actually mean that those problems were solved, or have we just moved on?
Of course not.
No.
We have shifted our focus into, so how much were they costing us? Who was involved in the procurement? How was that procurement done? Did we get value for money? Did we actually even get anything at all? Right? So we see that there's investigations that are going on at the Senate. The president has ordered the investigative agencies, and one would assume this would be the DCI and the EACC, to conclude investigations within 21 days. And when we were talking about this earlier during the newspaper review at about 6:40, we were saying that, when you give about 21 days, you are rushing a process that may need to get into the audit of the procedures that were followed. But we heard from the Senate on Friday, the suspended CEO of KEMSA, went to the Senate and said, you know what, I was receiving instructions from the higher-ups. And the higher-ups in this case, he mentioned the PS and the CS in the Ministry of Health. We know that the CS has talked about this previously and said there's cartels that run this particular ministry. The people who are supposed to have been receiving some of these donations, for example, that were brought into the country, some of the equipment that is supposed to be going to manage the healthcare system are our frontline workers. And these are the healthcare workers. Among them, of course, the doctors. And the Kenya Medical Association has been speaking out about this particular matter. So now let's bring in the president of the Kenya Medical Association, Dr. Onyino Were. Good morning, and thank you very much for joining us.
Good morning. Thank you for having me.
Daktari, you have, of course, seen what's unfolding now. We are talking about COVID millionaires. And just from the onset, when you heard of the COVID millionaires, when you started seeing the stories emerging of what is happening with the Jack Ma donations at the JKIA, what was happening with the procurement at KEMSA and in other counties at Afya House, what came to mind?
As a fraternity, we were really disappointed, and we are left shocked because all along during this pandemic, most of our members have actually been struggling with an issue of lack of quality personal protective equipment. And here we were in a situation where we got donations from the Jack Ma Foundation to help us mitigate some of these deficiencies that we did have. And here, all over the media, you see stories of how the donations and actually the funds allocated towards the COVID-19 pandemic have been not properly been accounted for. So as a fraternity, we were left very disappointed and shocked that even money allocated for such critical items can be spent in the manner that has been shared by the media in the last 2 weeks.
But looking at the operations of the health ministry, Dr. Were, would you really say that the medical fraternity was shocked? I mean, this is not the first time that we are seeing this kind of scandal emanating from Afya House or from the Ministry of Health or from the management of our healthcare system.
It's not the first time. We've had other scandals, and what we have proposed and suggested as the Kenya Medical Association is a reform agenda in most of the agencies that operate under the Ministry of Health, with a view of having them functional and being able to actually perform the mandate which they are formed. So in as much as it's something that we have seen, we had the Afya 1, Afya 2 scandals, we thought that in such a time where the whole world is grappling with such a pandemic, this is not something that will be the funds allocated to sort out the issues of COVID-19 pandemic will also be treated in such a manner. So I know reforms have been ongoing in the Ministry of Health, although slow and painful. We've seen the cartels fighting back the same reforms. And our shock comes from the fact that this was not a normal scenario to be treated in the manner in which we have seen. So it's like it has been business as usual, despite the very trying times we find ourselves in.
I'm curious as to now, so there's certain things that have been asked to happen. We hear from the president 21 days since when he made this announcement for these investigations to take place. So let's look and say that this has happened and it's found that there's misappropriation of these funds that could essentially have taken care of quite a number of health workers, for example, would have maybe helped to manage the situation when it came to COVID in the country. Then what? From the KMA perspective, what then would that What then would that be able to produce?
From the KMA perspective, I think once those 21 days elapse and the investigative agencies are able to get to the bottom of this, and actually, if they find any of the officers who have been implicated, then culpable of the misuse of these funds, then I think what we'll expect as an association is they need to step down. And I think we'll have to consider having new leadership, especially in the dockets that have been affected, so that we can move forward and actually the ministry should be able to perform its function, which is to ensure that everyone has access to safe, affordable, and quality healthcare in this country.
Will that cut it? Because you just a few minutes ago mentioned that, even with the reforms that you see, which are slow and painful, that we see that the cartels are fighting back. Would it cut it to have senior leadership within the ministry step down? If we have an internal rot in the ministry, is it just enough to say resign?
This is Africa and Kenya, to be specific, where we don't see people resigning or taking responsibility and actually shifting blame most of the time when issues of accountability of public funds come into play. So, of course, as an organization, we'll expect them to actually own up and step aside. But this should be guided by proper investigations being done by investigative agencies, so that the real culprits who are actually taking us back in time in terms of the fight for COVID-19 are actually brought to book. So, in as much as it's something that is not normal in our political space, I think it will be a step in the right direction if the leadership owns up that mistakes were made, and then we move forward towards correcting that mistake and putting systems in place that will not allow such a thing to happen in future. And of course, with that, as an association, we are willing to step in and give our professional input, as we've been doing all along this COVID-19 pandemic, and to help the government better respond to the issues on the ground where our members are.
Beyond asking members who have been found culpable of certain misdeeds, beyond asking them to step down, is there anything else the association does?
Of course, that will leave for the Office of Public, the judiciary to sort that out.
Actually, I wasn't going in that direction. I was asking if someone is a medical doctor, right, for instance, and you found they are found to be dishonest and untrustworthy with public funds, how then can you trust such a person with human lives?
Individuals are different. We all come from different households. We are raised differently, so you cannot blame an individual weakness of the whole fraternity. And of course, even in the medical space, we have mechanisms of ensuring our members are held accountable in terms of the code of practice, in terms when they are found guilty by a court of law, to have actually not been accountable with public funds. So if something like that happens and it affects one of our members, then they have to take personal responsibility. But that one, we cannot just base on hearsay. We need the investigative agency to do a proper job and actually get to the bottom of what the matter is.
It sounds like you want to leave this to just the investigative agencies, and the Kenya Medical Association itself will be just a spectator in this particular case. But it involves your mainstay. It involves the taking care of people's health. It involves people ensuring that they steal money that was meant to have gone to protect your healthcare workers, stealing money that would have helped the healthcare workers to take care of their patients. What else can the KMA do? And, as opposed to just sitting back and saying, let's wait and see how these investigations unfold.
Of course, as part of the auditing process, KMA is willing to participate with the network that we have throughout the country and our members. We will be able either to correlate or confirm that we actually received these PPEs on the ground, that we actually, as part of the audit process, that money allocated for hiring of more healthcare workers, that on the ground we actually saw some healthcare workers being hired by the government to respond. So I think that is a role that we can play. And in the past, actually, Kenya Medical Association used to have a seat as part of the board of KEMSA. I know we lost that along the way, but I think this is the role as professionals we can play, because imagine I'm sitting on that board, or a member of KMA is sitting on that board. We cannot allow such a critical function or such critical items that we need for our members to be used in the way that you've been seeing being portrayed in the media in the last 2 weeks. So, of course, we'll be willing to participate in the audit process, just like we participated in ensuring that we have quality PPEs coming into the country to ascertain whether our members actually got these PPEs on the ground. And also in future, maybe as part of the reforms, then being able to sit in the board of management as an organization to give our professional input on the table.
But Dr. Were, have you already started taking leadership in this? I would expect that maybe if you're already considering it, you'd already have rolled out mechanisms of auditing what exactly your healthcare workers received around the country, so that by the time investigators are coming to ask you, you already have a file ready. Or if Senate asked you, you can even volunteer to go to the Senate committee and say, this is what happened on the ground.
Yes. Actually, the process has started. Immediately, the expose came out in one of the media stations. We actually linked with the network that we have from our members in different divisions, all the way from Kisumu to Mombasa. And we are actually compiling an objective report from the ground in terms of what is the situation now. And that has always informed our weekly advice to the government, where we have a COVID-19 response committee that actually meets and gives advice to the government in terms of what the situation in the ground is and what we need to do. So this data has been collected since the pandemic started. It's just a matter of putting them together. And if you are invited to the Senate, then we will be available to actually provide that data so that it can be used to hold the officers involved more accountable.
This data that you're currently providing, what purpose is it serving beyond just information for the government?
You see, the data that we'll be able to provide from our members is basically trying, because you see, the investigative agencies will need to know the truth from the ground, because the message that has been going out consistently is that all our healthcare workers are protected and they are properly equipped to actually respond to this pandemic. But if you go on the ground, the situation is different, where you find you're supposed to have one mask the whole day and you're interacting with different patients. So you're not safe yourself as a healthcare worker or as a doctor, and also you're not, the patient who's coming to see you is not also safe, because then the risk of transmitting the infection to these patients then increases. So this data will help the investigative agencies actually correlate what we've been told, that, for example, the JACMA donations never reach the ground. We have members all over the country. We have members in Kemri. We have members in these organizations, and be able to tap into the experience they have or the information they have to actually provide this information to help the investigative agencies get to the bottom of this.
Dr. Were, I am stuck on a little point here.
Yes.
If one of your members is found to have abrogated certain medical processes, I'm sure you have a way of dealing with such matters. Now, it's a yes or no question. And
yes, we do.
Yes, you do. Yes,
we have a code of practice.
Precisely.
Yeah.
Now, within this code of practice, do you have a code for restitution? Because if a member does something errant, is there a time within which they can be brought back to the fold? Is there a way of bringing them back into the fold?
There is a mechanism in place, and I said there is a professional code of conduct which was developed by the Kenya Medical Practitioners and Dentists Council, and I was instrumental in that when I was serving in the same board, where if you find that one of our members has actually done something that has injured the whole fraternity, and affected the confidence of the public, then we should be able to do our own investigations and make our recommendations to the Kenya Medical Practitioners and Dentists Council for corrective action to be taken on such a member. But as I've said, that has to be left. We have to presume everyone is innocent until we have the facts.
No, I'm talking about when someone is actually guilty. But restitution, surely people make mistakes. And when they make mistakes, they must be given an opportunity to perhaps correct those mistakes and get back as much as they possibly can to the lives that they had before. This is what I'm asking. Is there such a mechanism?
There is definitely such a mechanism within the association, and also working hand in hand with the regulatory body, which once that information is provided to us, then we should be able to act on it.
Now, let me ask what I really wanted to ask. Now, if somebody who is a medical doctor is in a position of authority, say within government, and they make decisions which, not only put the lives of your members in danger, but put the lives of those in the public domain in danger. Now, when they are found to be culpable, what then? If what you have doesn't work, what then will your administration, because you're president, try and put into place to ensure that not only are they held accountable, but that the process of restitution also takes place?
We can hold them accountable within our organization and within the powers we have. As you know, KMA is an association representing doctors, and our key responsibility is to mind the welfare of our members. And we're actually trying to push, part of the reforms we're trying to push is to have Kenya Medical Association being a self-regulatory body where we'll be able to handle issues where some of our members become errant in terms of performing their functions. But now, as the law provides, it's still under the Kenya Medical Practitioners and Dentists Council, who will be able to review the information that will be shared once they are found guilty, for example, from the judiciary. And there are different things that can be done, which include suspension of the member from practicing for a certain number of months, 2 years, revoking of the license, and then we leave it now to the judiciary to actually now, if the funds can be traced, then to put mechanisms in place to recover those money or funds that have been lost.
Dr. If we look at KMA as a professional association and we look at the other professional associations on what is expected of them by their members and by the general public, as KMA, you have been seeing what's been happening at Afia House, for example, and you just said Afia, the scandal, the first scandal, the second scandal, and this latest scandal, and even to a point where the CS himself comes up and says there's a lot that happens in these corridors of Afia House. As a medical association, is there anything that you have ever done to try and unravel the persons behind all these cartels, to try and identify who exactly are these barons, and to try and, let's say, just bring down this particular cartel?
We have consistently, and even if you look at most of the press media statements we've been issuing about all these countries, we have consistently advocated for professionals' input in terms of trying to resolve these, I can say now, chronic corruption that you are seeing in our mother institutions. So we have consistently voiced our concern about it. We have consistently actually advised and requested to sit in some of the boards, which happily we do sit. And we have actually been able to push for that reform agenda within those particular institutions.
But beyond voicing concerns, Bona President, beyond voicing concerns, what action have you taken? I mean, you are the end consumer. Whenever this cartel goes and infiltrates the procurement route, you're the end consumers of what, whether it's the drugs or the equipment that they buy. You're the end consumers. What action have you ever taken?
We have protested against it, and if you look at most of our members working together with the Doctors Union, we have actually come out and even participated in an internal investigation within the ministry, where we came up with a Musimi Task Force report, where we actually came up with this policy document that recommended the changes that needs to be done in the ministry, so that we can be able to have it more functional or more effective in performing its function, so that we can have everyone have access to quality healthcare in this country. So we have protested against it in writing. We have participated in the reform agenda within the boards, and we have actually even held protests against it. And I know more can be done, and we continuously engage the Ministry of Health in terms of coming up with policies that are reform-based and that will ensure that actually such a thing like we have seen the COVID-19 millionaires does not come up. But you see, the implementation then has to be, we can push for it, but the government then has to buy in our professional input and actually implement it itself.
This is the Situation Room. It's Kenya's biggest conversation. On the line with us this morning is Dr. Were Onyino. He is the president of the Kenya Medical Association. We are talking about COVID-19 millionaires, the corruption cartels at Afia House, what we are seeing now, the investigations ongoing at KEMSA, the management of the COVID-19 funds, and all this because it affects the people who are our frontline workers, and these are the medical professionals, the doctors, and the others. And this is what Dr. Were Onyino is giving us this morning. And CT, you've got a question for the Dr.
Yes. What I wanted to ask was this. He talked about policies and the conversations they've had with the Ministry of Health. And if I understand it, the Ministry of Health has departments and it has divisions. Many of these are actually populated by medical doctors. So beyond just the conversations and pushing by having more conversations and determining policy, and probably going to talk to the Committee on Health within Parliament, what else does the KMA do to ensure that all these policies that they are agitating for actually become a reality?
Okay, thank you. I know in the Ministry of Health, we have some of our members who serve in different capacities. But as we know how a government functions, we
actually no, we don't. Tell us, how does a government function?
I've not served in government despite being.
I apologize for putting you on the spot, but
it's a complex process, and you cannot really zero in and say that since our members do have technical positions in the Ministry of Health, then they need to do more. Of course, what we know, they have done their best. We are always in constant communication in our meetings, and the final implementation step of these policies is mostly determined by the politicians who are actually heading these ministries. And if you see, from time to time, we have actually been advocating that we do have actually technical, a doctor even to the most senior, most position in the ministry are serving there so that they can better implement these policies because they understand it better. But you see, once it's a political process or a political appointee who comes on board, we can only give the technical advice, but also, the government has its own priorities and there are so many other considerations and balancing they have to do.
Daktari, there is no one in this country who at some point or the other does not need the help or the attention of a doctor, including these politicians we are referring to. There is talking to them as groups, but then there's lobbying, surely. All these high-flying politicians and powerful people have doctors, and many of them are your members. Have you actually exercised the entire might of your membership to actually ensure that the things that you want are pushed to the level that they should be?
We actually continuously do that. And from, if I just give you can have a peek at my diary and you can see working together with structures within our organization. We have actually reached out to the ministry level. We have actually, where we sit in different committees, technical working groups. We have reached out to the Parliament, where Parliamentary Health Committee, to the Senate Health Committee, and we continuously engage them to actually implement these sound policies that we do have as a country.
And is it working? I've got to ask, is it working? Because if you say you have a diary full of constant meetings and constant communication over and over and over again, engaging these individuals, is it bearing fruit or has apathy set in? So it's a tick the box exercise when you say, I've got to have this meeting because it's necessary for it to be seen that there's something I'm doing.
In some instances, it has actually worked. And I can give you an example actually in this COVID-19 pandemic where we were very instrumental in terms of pushing for a COVID-19 fund to be established. And through this fund, we have seen, working with some of our partners, we have actually seen initiatives from the private sector where personal protective equipment and other infrastructure development issues being addressed by this constant lobbying and through the different organs of government. So in some instances, it has worked. In some instances, is where now we see the cartels coming to stop the good work that you are doing in terms of diverting those funds to be used to other things. And just as a matter of note, in Rwanda, which is part of the EAC, if you look at most of their health policies and the things they're implementing in their country, they actually borrowed from Kenya, and they're actually doing well. And I think it's something that we need to now get into the culture of actually implementing these good enriched documents that we have at the Ministry of Health. So in some instances, we have had success stories. It's not all failures, and in some instances, we need to do more.
How vibrant is your calling out mechanism? Because you talk about, knowing who the barons are, knowing who these cartels are. You start up something and then you hit a roadblock, and the erectors of this particular roadblock then would be the cartels, as you've mentioned. How efficient is your calling out mechanism at the time that it happens to say, this is what is going on at this point? Because I see a situation where if there are certain things that you've been trying to accomplish over time, and it is the same people who keep posing roadblocks over and over, that you would want to say something like this in public. Or is it too scary of a thing to comprehend?
We can only do as much as a professional association, but we will continue pushing for these reforms. And I think the term cartel is actually a bit misleading because when you put cartel, then people are able to hide behind that term instead of the certain officers taking responsibility for the action of the officers who sit there.
Okay, since you introduced it as a cartel, so are you now saying that it is not actually cartels, but it is people who've been tasked with the responsibility to get something done within the ministry and actually not doing it?
I think that I'll correctly put it as that. But what I'm saying, the issue of cartels is a bit misleading because people will tend to hide behind these curtains called the cartel.
Yep.
And if you go to the bottom of it, you find it's individuals who are actually supposed to be providing public service,
Right.
who are not doing it according to the laid rules and regulations that are in our ministry. So these individuals then need to take individual responsibility, and they need to be taken to task so that you can be able to address these issues. But when you say cartels, then everyone goes and hides behind
And
that.
says there's a cartel.
Is it possible to unveil who these individuals are?
Absolutely.
The best person or the best institution that can be actually get to the bottom of it. We have the DCI, we have and the judiciary. They work together,
Right.
then be able to get and identify who these culprits
But
are.
it gets
And
information.
because they're just criminals, and
It
then take action.
The investigative agencies get information from people
In
and
fact,
from institutions.
Yeah.
Would it be possible for the Kenya Medical Association to go ahead to the EACC or to the DCI and actually blow the whistle on these particular individuals?
If we know them, we'll gladly do it. We'll gladly write to these different institutions and provide them with the information that they need to actually be effective in the function that they do perform.
I'm sorry, Doc, but I'm finding it difficult to actually comprehend and accept that an institution as influential and powerful as the Kenya Medical Association would find it hard to know who these particular officials are who are not doing their job. It is possible for Eric not to know. It is not possible for the Kenya Medical Association, with all the might and with all the history that it has, not to know, really.
I wouldn't say that we are completely blindsided to who the individuals are. But we have the rule of law in this country, and we have to follow, we have to abide by the constitution and the different organs and the roles that they have to play in terms of getting to the bottom of this. In as much as an association we can call out, it only serves as maybe directing them to the right place where they need to do more in terms of looking into the accountability issues that we constantly face. But as I've said, it's still a political responsibility at the end in terms of ensuring that these particular individuals who, for me, they're just basically criminals, are then held accountable. Or they were stealing of public funds.
Do you think they're actually going to go and
the
report themselves? I've just got to ask. Do you think, if you say that it is political, individuals who have political leaning or affiliation are the ones then who then bear the responsibility to do this, and it may be their colleagues, do you think that they're actually going to go and report themselves?
That would be a new normal in Kenya. But
Exactly.
Yeah. So what you can do as an organization, we have our networks. We know one or two individuals. We see what is happening on the ground, and we are ready and available at any time to provide that information so that the investigative agencies can actually do their job. But then, as I said, the buck stops with those investigative agencies and the political leadership then to take action once that information is provided to them.
Does KMA and the individual disciplines represented within it have a mechanism for not just self-regulating but self-assessing the performances of their members within what is required of them?
We have members who serve in different boards in the Ministry of Health, and we have meetings where they actually report back to us in terms of how they're representing the organization and what we want to push, the agenda we want to push in those bodies. But in terms of those members of, who work in different government bodies, then I think there's a clear HR department, HR function, where they have their own performance appraisals and they're able to be held accountable in terms of performing their function in those particular offices. So we can only hold the members that we have sent into the boards, but there are others who serve in government and other institutions, and those institutions have their own mechanisms of doing a performance appraisal and knowing how the members actually do perform their jobs.
You know, there's a risk here, Doc, of the public actually looking at KMA and other such professional institutions and seeing as if they are complicit. Because, again, looking back at the kind of influence that the KMA has, if you look at your membership, people who have either been members before, they're current members, they've been leaders of this organization, are senior people in government, are senior people in the private sector. So you basically have a network that understands how healthcare works in this country from beginning to the end. You understand how procurement of healthcare happens. You understand how management of healthcare happens. And when you sit back as an association and say, you know, we want to point fingers and make noise at officers who are not doing their work and not mentioning them and not saying this is exactly the office that is responsible for this, that, and the other, then you could be seen to be complicit.
Contrary to that, we have not been complacent to what has been happening. In fact, if I can just emphasize, we have our members who actually serve in the Ministry of Health, and they are actually doing their work professionally and to the best of their ability as they've been trained. And the challenges that they do face is actually now in implementation of the professional inputs that they do give to the Ministry of Health. So we are not complacent. We continue to participate, we continue to advocate for implementation of these policies developed by our members, who most of the time do their work. Actually, majority of them, I know them as colleagues, and they actually do implement, they do their work as professional as possible. And we have continuously guided them, we have continuously spoken out against any misuse of the public funds meant for COVID. We have continuously, every week, put out an advice on terms of where we need to go and what we need to go to actually address this pandemic or respond to it better.
But
so
have you ever censured any of your members because of a role that they may have played in their place of work?
In fact, if you remember, in the past leadership of the Ministry of Health, we actually did censure one of our very senior members for going against the professional code of practice as we know it. So we have done it in the past, and we are ready and willing, once all the information has been crystallized, to actually call out any of our members and guide them in terms if they're not doing their function well. But as I've said, our members have continuously performed their functions in the ministry professionally, and what we need is the political environment to be made better, so that these policies that they've actually developed are actually implemented to serve Mwananchi better.
Looking at the lessons that the country is learning from COVID-19, and going back to the implementation of what we were seeing earlier as the universal health coverage program, what do you think the lessons are that we can take from this?
The lessons that we are getting from this particular pandemic and the issue of the COVID-19 millionaires is we need to ensure that we have the different agencies of the government, and I'm talking about the different boards and councils, properly constituted according to the law, which actually was done according to the Mwongozo principle, where we envisioned good governance in most of these boards.
Yep.
And we need to give them the independence to actually perform their function, guided by the different boards, so that they can be able to hold the officers who work within those agencies accountable. Once we respect the professional input and ensure that there is space, the political space is there for these agencies to actually perform their function,
right,
then I think we'll be able to actually implement the UHC the program better.
Doc, stay on the line as we also bring in nominated Senator Sylvia Kasang, who's just called in. Good morning, Senator.
Good morning. How are you?
Very well,
Morning.
thank you. And karibu to the Situation Room.
Thank you so much. I really appreciate.
You're part of the team that is investigating this scandal at the Ministry of Health with regards to COVID-19.
Yes.
And you've heard the conversation that we're having with the president of the Kenya Medical Association. Do you have a question that you'd like to ask him?
Yes, a question, a request, and as well a bit of a challenge. We've had interactions with KMA at our ad hoc committee of COVID-19 earlier. And they did come in and they gave us quite a bit of information on how the government was handling the COVID situation on the early onset. And they gave us very good information to work with. And they did give us also areas where we could intervene as politicians on helping, interactions with the national response team. And we really appreciated it. Now, we've not had a second interaction with the KMA, but I've listened very keenly to the president, and I appreciate that Spice FM has had him today. I've listened very keenly. As you're aware, we are looking for the COVID billionaires.
Yep.
And we are really curious on how things move around, instructions move around, how money moves around in the Ministry of Health. Now, I would have expected KMA to have truly told us something. And he has very well said that they may know a thing or two, and they are available. If somebody reaches out, they are available to give whatever information. So I'm reaching out. And I want him to come and address the committee and tell us what they know. KMA does have committees that work with government. That one they told us.
Yep.
And we know the role they played in this COVID situation. And they did a fantastic job from the early onset. But surely now we are looking for COVID billionaires. We want answers. We are happy to receive any form of answer. And that 1 or 2, 3 things that he says he's aware or he knows, we want him to come to the committee and address us. And I also just want to remind associations. Associations have a very critical role to play in issues of governance because they can lobby. And I'm happy you did push him to answer as to why they don't lobby adequately. He was very cautious with his answers, but they have a duty to Kenyans. They have a duty to Kenyans. They have a duty to lobby, right?
Yep. Senator, we are losing you, but as you get your line back online, Dr. Were, you've heard the challenge that the senator is basically just throwing at you. You've said that you may know a few things here and there. The Senate committee is investigating who the COVID millionaires are, who the actual beneficiaries of our money are.
Yes, I'd like to thank Mheshimiwa for actually highlighting the role that Kenya has actually played. And I think we'll wait for the invitation from Senate. If they want our views and tell them what we know, we'll be more than willing to actually do that. And actually accept the challenge. As an association, we need to do more. And you're going to see more being done in the next few months and days to months as an association in terms of improving the governance and ensuring there is good governance from our mother ministry. So we accept that challenge and we're going to do more. And I'm sure you're aware that we've just come into office barely a month. So we'll be able to pick up from the past good work done by our predecessors and actually take it to another level. And we'll be willing to work with the Senate and the Parliament, in fact, to further strengthen KMA to become the self-regulatory body for doctors so that you can hold our members more accountable.
I think also, as you look at this, there's an image to promote as well as protect when it comes to this association, and looking at the critical role that you have to play when it comes to some of these things. And even as you said, as you're waiting for this invitation, I think when we look at some of these things, certain proactivity then also would be required, especially when you're working within a time frame that, as we speak now, is running out. And if things are going to change, if things are really going to change, then the way of doing them also needs to change for that kind of change to come about. What, in terms of a facelift for the state of health in this country, vis-a-vis the way things have always been done when it comes to health, needs to take place for us to see this kind of change that we are talking about?
Actually, what we can do as an association, of course, we will be able to provide any kind of documentation or information that will be requested of us. But I think as a step moving forward to ensuring that there's better governance and accountability from the Ministry of Health, I think it's time that the professional input, especially from KMA, is actually considered, and the policies that we contribute towards development of different committees are actually implemented. If that is done, I can assure you, you'll see a lot of improvement in terms of how health services are rolled out in this country. And of course, that goes hand in hand with working very closely with the County Council of Governors and the counties to ensure that actually Wananchi there at the village level is able to access quality and affordable healthcare. So the issue is we'll continue pushing for the implementation, because we have the good laws. And as I've said, Rwanda is actually just implementing our policies. And you can see the change of the impact of that in terms of their health system and the health space, and even the way they have responded to the corona pandemic. And I think back home, we need actually to consider very seriously the professional input, especially from KMA, and implement it so that we can move forward and leave the issues of the scandals at our mother ministry in the past.
Thank you very much, Dr. Were Onyino Were. Thank you for speaking to us. Dr. Were is the president of the Kenya Medical Association. We thank you for speaking to us this morning, and we hope to have more conversations with you in the near future.
Thank you, Latu. Thank you for having me.